The Health Department says an anti-HIV injection is too expensive to acquire despite a significant drop in the price. The British drug manufacturer VIV is behind the jab, which is injected twice monthly and helps to reduce the chances of infection. For more on this, let's speak to Bhekisisa Executive Director Malan. Mia, a very good evening to you. Good to have you on News at Prime. So just why exactly is the shot so expensive?
So, Dembekile, this is a new product on the market, and new products are normally very expensive because large quantities of them haven't yet been made. But in the case of this specific injection, which is an injection, if you take it, it really wipes out your chances to acquire HIV through sex. So it's sold in America. It's one of the countries where it's already available for 70,000 rands per shot, so per injection, and you need to take it every 2 months. So for a year's stock, you would need 6. So that's obviously quite unaffordable. So VIV Healthcare, the company that makes it, last week announced a non-profit price for donors and for governments like South Africa. And that price is between 540 and 570 rands for one jab. And the reason our health department says it's too expensive to afford is that we have another form of HIV, a pill that can prevent HIV. You have to take it every day. And they compare the price of this injection to the price of the pill. Now, the injection you take once every 2 months. If you compare that to the price of 2 months of pills, 2 months of pills cost about 130 rands. So it's 4 times more expensive than the pill, and they feel it's not cost effective if we then have to buy the injection as well, even though studies have shown that it works a little bit better than the pill because it's easier to adhere to.
So the expense then, the cost of this particular shot, is it a major disadvantage to South Africa? By that I mean, is it an absolute essential that we need to add it to this country's HIV prevention program?
I think most experts would say yes, and the reason for that is, first of all, it's the form of PrEP. PrEP stands for pre-exposure prophylaxis, so it's medicine you take before you're exposed to HIV to protect yourself. There are 3 types of PrEP available at the moment, and it's the injection, the pill, and there's also a vaginal ring that you can use. And research shows us that the more options you give people to choose from, just like, for instance, in the case of contraception, if you give options or choices, the chances of people using it is significantly higher. Now, you may ask, why do we want the injection if the pill works almost as well? Well, in the case of the pill, you have to take it every single day or it won't work that well for you. And many people struggle with remembering to take a pill every single day. So in the case of the injection, you only have to take it once every 2 months. And in the case of the vaginal ring, for instance, you only have to change it once a month. So the more options there is, the better. You might ask, why do we need it? Well, we still have a significant amount of new HIV infections in South Africa. In 2022 alone, we had 165,000 new infections.
So how much then of the inaffordability of this new shot, not a new shot, but this drug, this particular injection, how much of this inaffordability has to do with the fact that as of 2 weeks ago, the finance minister announced a significant cut to the health department's budget, and therefore it's having to cut the cake differently, if you will?
So the cut from that health department's budget was for HIV treatment, so it wasn't for prevention. But yes, there's still a cut and there's still austerity measures. So the health department has mentioned that within the context of, first of all, it's a lot of money for the injection, but secondly, there's also budget cuts. It makes it very hard to afford. Now, one way around this would be to accept donations from donors, like, for instance, PEPFAR, which is the US government's AIDS fund that buys a lot of treatment for Africa. Now, in South Africa, we have, for instance, when it comes to our treatment parts and not prevention, we don't really accept donations. The government pays for all our antiretroviral drugs itself. And the issue with sometimes accepting donations is that if the donor then decides to stop to donate, you need to stop a program. But Our neighbors have already accepted donations. There are 3 shipments on their way to Zimbabwe, Malawi and Zambia. Those 3 countries will later this month receive their first shipments from PEPFAR-sponsored HIV prevention injections, and the hope is that we will then also accept such donations, at least at the beginning, to be able to make a start, because many experts regard this injection really as a game changer.
I know the price is somewhat reduced from the more than 700 rand that was spoken about in the last year or so. In South Africa, you're saying we would have to pay the equivalent of 540 to 570 rand per shot. But to what extent does this conversation tie in with the broader conversation about the cost of healthcare and how pharmaceuticals have, to a degree, in fact, a large proportion, put profit over the well-being of society globally? Is this part of that? I mean, there's also the big fight that we know even this year we're still playing out about patents and permissions for generics, etc., to make sure that everyone around the world has access to good treatment.
It's certainly an issue, and it's been quite widely discussed around the injection. It's that issue of it was tested in many African countries, including South Africa, and now when it comes into the market, it's outpriced for the countries who contributed to giving the pharmaceutical company the data to be able to determine whether this injection works or not. Now, VIF Healthcare has issued 3 generic licenses to 3 Indian companies. One is Cipla, which has a plant in Durban, and they are planning to manufacture the injection there, a cheaper version, hopefully. But the issue with why the branded drugs price is an issue now is for these generics to be made, it will take time. We need to transfer technology. They need to build facilities to make it. And then once they've made the product, it needs to be tested to see that it works in the same way as the branded drug. And that process will take at least 3 years. That's if they move really quickly. So we're not looking at getting generic drugs before, at the earliest, 2027. So at the moment, all we can do is to really, really fight for the price to go down. The price will go down as orders go up because of economy of scale, but it's not expected to go down to the price of the HIV prevention pill. So something needs to happen in between. We either need to accept donations from large donors, or the orders that donors buy for African countries need to be so large that the price goes down. The complicated issue around this is just that we don't yet know whether people will use it widely. It's one thing to see in a trial that a drug works. It's a completely, entirely different issue to get people to use it. And when we introduced the HIV prevention pill, the uptake of that was pretty slow. People didn't just use it because there was a pill who could protect them. So the big issue in this case is as well, how do we create a market for it, and how do we create demand for people to use it? And in order to find that out, we do have 7 implementation studies that's going to start in early 2024 that is going to figure out exactly those issues. How do you get people to use it? How do they prefer to get it? Maybe they don't want to go to a clinic to get it. Maybe they want mobile clinics to go into the community to figure out what are those ways and things that we need to do to make it as easy as possible for people to use this injection.
Malan, good to speak to you as always from Bhekisisa. Thank you for your time.